This drug, amifampridine, was tested, again, I keep saying that I like the design of these studies because they were done in a very unique and interesting way because of how interesting this disease is and the pathomechanism. They did 2 phase 3 studies. They started with one with a single arm and went on to randomize and double blind and withdraw trial. And we'll talk about that, like how did they do with that design. They treated all patients with amifampridine, and patients then were randomized to either continue with amifampridine or to take it away. So we wanted to see improvement when they treated them, and then we wanted to see the worsening when we took it away and gave them placebo. So we're confirming twice that it is the medication that's doing the effect and not the natural fluctuation of the disease.